The clinical downside of ketamine, and I can just tell you from experience, we've been doing ketamine in our clinic for about 5 years. Clinically, it really helps in an emergency. Somebody is suicidal, somebody is at their deepest depression. I can typically pull them out of that fairly quickly with IM ketamine or intranasal Spravato. I haven't found it to be clinically efficient for a short term. So when ketamine first came out for depression, we thought you're going to come twice a week for 4 weeks, then once a week for 4 weeks, and then you're going to stop and your depression is going to be significantly better. Can psychedelics heal your grief? There is a recent study that came out by USONA Institute, and they did a trial with psilocybin for major depressive disorder. A lot of people are talking about using psychedelics for the treatment of depression, for all kinds of trauma, grief, and we have to be careful of making a statement of or a belief that one thing can heal all. However, this is very promising. So the study studied specifically 25 milligrams of psilocybin with people with major depressive disorder, and they had a significant improvement in their depression from one dose within 8 days, and it maintained for over 6 weeks. That is pretty significant. Now, it is important to note that the people that were in the trial were not like refractory depression or difficult to treat depression or bipolar depression. It was just straight major depressive disorder. But the study itself really gives hope to what it does for the brain. And my name's Cristi Bundukamara. I'm a psychiatric nurse practitioner. But if you're watching my videos, you know that my real experience comes from my grief and my trauma and how I have been able to process, work through, and be strong in the midst of that grief. And so I want to tell you this story of psychedelics in relationship to grief from a personal place first, and then from a professional place. So from a personal place, I became a grief expert a couple years after my son Reggie died. Now, Reggie died from a medical trauma. He was sick for 10 years, and I had already lost a son prior to that in a drowning accident. So here I'm losing my second son from a rare neurodegenerative condition. And the 10 years prior to his death was a lot of medical trauma for me as a parent. He broke his femur in the middle of a seizure. We had spent multiple nights in the ICU thinking that he was going to die. And so there was this 10 years of medical trauma prior to his death and a lot of anticipatory fear on his death. But I never really let that sink in. I was fighting for his life. When he died, I really began working on grief. And I opened Mentally Strong, and I talk a lot about controlled grief. Controlled grief is taking that time to actually process grief, not trying to just push through and go to the next level. So here I was, I had lost a son in a drowning accident, a son to a medical complication. I had one living biological child left and several adopted children. And my daughter was not sick. She had the same disorder as my son, but she never spent the night in the hospital. There was no medical trauma around her. There was fear that maybe 15, 20 years down the road, she may be sick like her brother. But one night she died in her sleep of sudden unexpected death and epilepsy. And that death has hit me harder than any other grief that I'm experiencing. And I also have lost my husband to the same disorder. But Maya's was so unexpected and so traumatic because I found her and I did CPR. And so there was a lot around that. I had already started Mentally Strong. I was already putting myself out there as a grief expert. And here it was hit with me again. And I went through 45 days of grief. I have a grief documentary. You should look into that. I have a grief course. You can see information about that on the descriptions. But during this period of time, a year and a half after her death, I went all in to try to truly be a grief expert who has processed grief. And in the midst of that, I did go and get treatment with ayahuasca, psilocybin, and ketamine on different occasions. And I can tell you as a grieving mother I did not go into it with that professional intention, right? The ayahuasca was the first thing that I did, and I went out of the country and I went to where you would do it in ceremony. And my intention was to have a spiritual experience, that I would somehow connect with my daughter and see my daughter and feel God's love. Because when you lose a child, you don't feel God's love. It creates like this break. And I went in with kind of this intention to have a spiritual experience. And I remember very clearly it was 2 nights in a row. And the first night I did not even feel anything. Maybe a little bit like relaxation and maybe a little intoxication, but nothing significant. And so the next night they gave me triple the dose, and I got very sick, physically sick. So I was throwing up and still had no positive experience, no spiritual experience. And coming out of that the next morning and trying to meditate and integrate and process what had happened, I realized as I was sitting there throwing up that I did this to myself. Practically did this to myself because I, took the ayahuasca. But deeper, from a spiritual perspective, I realized if God asked me today, would you do this? Would you go have children, lose children, and then share how you process it? I would say yes. I wouldn't give up what I had to not have that experience. And so even though the moment did not give me what I expected, the integration and the processing after really did. And so the point of that is you can go in with an intention, but make sure that you are ready to receive whatever it is. And it may not be what you want to hear. I took psilocybin in my home from a private gift, and really did not feel anything. I'm not quite sure that process did anything for me. I'm not quite sure on the milligrams, but I think it was close to 25, and I did not feel anything. And then I went to my colleague and psychiatrist and did IV ketamine, and that created a relaxation, but again did not produce what I was hoping for in that moment. But the integration and the processing afterwards, I think, really kind of solidified for me that my spiritual growth does not need to be through a substance, that I have since worked out a lot of my spiritual conflict. I do believe that God loves me. I do believe that I can connect with my children, and you can watch my journey on some of these other grief videos. But so yes, I do believe that these 3 experiences that I did, ayahuasca, psilocybin, and ketamine, were a part of the process. But I think we have to get away from this idea that there's one thing that's going to fix everything. And what I teach in the Mentally Strong Method is that there are probably 10 plus categories that you can be working in. And grief is one of them. But what often happens with grief is everything gets enmeshed. And you think everything has to do with grief, but there's other components. There's negative self-talk. There's anxiety. There's choices that you're making that maybe are not in line with how you want to process this grief. Shifting gears here, as a professional, I'm a psychiatric nurse practitioner. I run a clinic with over 7,000 patients. I live in Colorado, where psychedelics are decriminalized. You are allowed to give them as gifts. You are allowed to consume them. And so we have patients who are using psychedelics. The problem from a professional standpoint is I don't know the source. I don't really know the milligrams. And sometimes I have patients who are using multiple doses. And there is some research that there could be a negative outcome for the cardiac valves with long-term use of psychedelics, right? So as a professional, when someone else is telling me about their experience, it's hard for me to really engage in that because of it not being in a controlled environment. However, I do encourage you to let your psychiatrist know if you are going to do one of these experiences, because there's lots of things around it. With psilocybin and ayahuasca, you are not supposed to be on an SSRI, so you would have to wean that SSRI prior to doing those experiences. So there's things around it. You should not just be doing this experience because your friend gave you a gift, right? Do a lot of research around that and make sure that the source and the milligrams are safe. Ketamine, which is also considered a psychedelic, however, the mechanism of action is different than psilocybin and ayahuasca. And so ketamine is legal. You can get treatment probably anywhere, definitely anywhere in the US, probably in other countries through IV ketamine. There's also a medication called Spravato that can run through your insurance, and it's an intranasal spray. The clinical downside of ketamine, and I can just tell you from experience, we've been doing ketamine in our clinic for about 5 years. Clinically, it really helps in an emergency. Somebody is suicidal, somebody is at their deepest depression. I can typically pull them out of that fairly quickly with IM ketamine or intranasal Spravato. I haven't found it to be clinically efficient for a short term. So when ketamine first came out for depression, we thought you're going to come twice a week for 4 weeks, then once a week for 4 weeks, and then you're going to stop and your depression is going to be significantly better. What we have found clinically is that most people, I would say 80 to 90%, have to stay on some sort of maintenance. There is a new antidepressant out that does work well in combination with ketamine called Auvelity, and we've been able to get several people off of maintenance, ketamine maintenance, with using it in combination with Auvelity. These are all things that need to be discussed and processed with, obviously, your provider. Ketamine should not be used from a gift. It should be used in a controlled environment. So that's the positive and the negative that I see with ketamine. It's also pretty inconvenient. So you have to come twice a week, and you have to be driven by someone else because you can't leave driving a car. You have to stay there for approximately 2 hours to be monitored during that treatment. So it's a little inconvenient as well, but could be really part of your healing journey. So when I say using psychedelics in grief, grief is most often, especially intense grief, like mine, is complicated. It doesn't just have one symptom. It's, grief of losing an expected older loved one is the natural process of grief. But when things are more of a traumatic grief, it's very complicated and it meshes in everything that you are trying to work on in your brain. So what advice could I give you? Take ownership of your grief journey, your mental health journey. If you are experiencing depression, which often happens in intense grief, do not go back to that old grief theory that says depression is normal in grief and that you'll eventually get to acceptance. If you meet the criteria for major depressive disorder, if you're thinking about hurting yourself, you're thinking about suicide, you can't get out of bed, that is not normal grief depression, right? And it's also important to note those 5 stages of grief that we learned were written for the hospice patient, the patient who was in the dying process, not the loved one who was experiencing the grief afterwards. Okay. So it's often misused. Depression needs to be identified and treated as depression and not just saying it's grief. So taking ownership of that, getting help for depression associated with grief, and that may be choosing to do a psychedelic. But make sure you're doing it, thinking that process through. If you are on antidepressants, you must talk to your doctor prior to doing that kind of treatment. And knowing that it's complicated, that it's not just one experience is going to take away your grief. You have to go on that healing journey. And you can do it with the Mentally Strong method. And I often talk about my grief and I sprinkle in the Mentally Strong method. But what has made me survive these tragedies. I can say I have my grief being processed properly, and I'm not letting it seep into anxiety and negative self-talk and the injustices that have happened to me. And I'm working through my spiritual conflict. These are all things that you do differently. And so I challenge you to really take ownership of this journey. Come watch some more of my videos. I have a whole grief playlist where you can see this journey of mine throughout many years of grieving my children. I believe that we can process traumatic grief and be stronger in the midst of that.